Okay, so as an endocrinologist, you're on the front lines of metabolic disease every single day. But here's the thing. A really serious condition, metabolic dysfunction-associated steatohepatitis, or MASH, is hiding in plain sight among your patients. So this is your practical guide to finding those high-risk individuals who need your help before it's too late.
Just think about this number for a second. 6.4 million. That's how many people in the US with type 2 diabetes are estimated to be living with MS. This isn't some rare liver issue. It's a silent epidemic, and it's unfolding right inside your practice. These are your patients, and they are at risk for progressive liver disease that often shows no symptoms.
All right, so here's what we're going to cover. First, we'll talk about why MASH is such a hidden threat. Then, we'll get really specific about who's at high risk. We'll introduce a super simple screening tool, the FIB-4 score, walk you through the official referral pathway, and wrap up with why doing all of this is more important right now than ever before.
So let's start with the big picture here. It's really easy to think of MASH as just a hepatology problem, right? But that's not the whole story. At its core, it is a metabolic disease. It's completely intertwined with everything you manage day in and day out. Obesity, insulin resistance, you name it. It's basically the liver's manifestation of metabolic syndrome.
And the stakes? They couldn't be higher. The Cleveland Clinic puts it pretty bluntly. If you don't treat MASH, it's a direct path to some very serious liver damage. All that chronic inflammation it causes can progress to fibrosis, cirrhosis, and even liver cancer. And the scariest part is that this whole process is often completely silent. Your patients might feel perfectly fine until the disease is already dangerously advanced.
So the big question is, how do you find these patients without having to screen absolutely everyone? Well, the good news is, recent global consensus guidelines have given us a really simple first filter. They've streamlined the whole process, so now we have a clear, evidence-based way to pinpoint the exact patients who need to be checked for high-risk MASLD.
Here it is. This is your high-risk MASLD screening checklist. It really comes down to 3 groups. First, any patient with type 2 diabetes, period. Second, patients with obesity who also have at least one other cardiometabolic risk factor, think hypertension or dyslipidemia. And third, anyone who's had persistently high liver enzymes for more than 6 months. Okay, so once you've flagged a patient who fits one of those profiles, the guidelines recommend a really practical first step. And we are not talking about some invasive biopsy or an expensive scan. Nope. The recommended first-line tool is a simple calculation called the FIB-4 index. And the best part? It uses lab values you probably already have in the patient's chart. So what exactly is this FIB-4? Well, it's a validated scoring system that gives you an estimate of how likely it is that there's advanced liver fibrosis or scarring. It's so powerful because it just takes 4 simple things: the patient's age, their AST, their ALT, and their platelet count, and rolls them into one single actionable score. It's cheap, it's accessible, and it's been validated for this exact purpose. Interpreting the score is also really straightforward. The global consensus guidelines make it simple. For your patients under 65, any score below 1.3 means low risk. For those 65 and older, that low risk cutoff is a bit higher, less than 2.0. So if they're low risk, you can just keep an eye on them in your practice and retest it a few years. But if the score is at or above those numbers, that's your red flag. That's the trigger to take the next step. All right, so a high FIB-4 score means you need to do something. So what's next? Well, the guidelines give us a crystal clear pathway for figuring out what to do with your patient and knowing exactly when it's time to refer them to a specialist. This is it. This is the entire process laid out visually. Now, I know it might look a little complicated at first glance, but it's actually a very logical decision tree. Think of it as your roadmap. We're about to break it down into simple, manageable steps right now. You can really boil this whole pathway down to 5 simple steps. 1. Screen your at-risk patients. 2. Calculate their FIB-4 score. 3. Look at the score. If it's low, you just retest them later. 4. Now, if that score is high, it's time for a second test to actually measure liver stiffness, usually a VCTE, which you probably know as a fibroscan. And finally, 5. If that VCTE comes back at 8 kilopascals or higher, that's the definitive trigger. It is time to refer to hepatology. Now, following this pathway isn't just about good medical practice, it's become incredibly urgent. For years and years, our main tools for MASH were diet and exercise, but the whole therapeutic landscape has just completely changed, making this early identification and referral process more critical than ever. So what was the game changer? It arrived in March of 2024. The FDA gave accelerated approval to Resmetirom, brand name Rezdiffra. This was a landmark event. It is the first and only medication specifically approved to treat MASH with moderate to advanced liver fibrosis. So we're talking stages F2 to F3. For the very first time, we have a targeted drug therapy for these high-risk patients. This new reality creates two completely different futures for your patients. On one path, their MASH goes undetected and it just silently progresses towards cirrhosis, liver cancer, and higher cardiovascular mortality. But on the other path, early identification and referral literally open the door to specialist management, close monitoring, and now eligibility for new therapies that can actually change the course of their disease and improve their outcomes for the long haul. So, the takeaway here is crystal clear. As an endocrinologist, you are seeing the highest risk patients for MASH every single day. You are in the perfect position to put this screening pathway into practice. Just by systematically calculating a FIB-4 score for the right patients, you become the key to unlocking early detection, and you can literally change their health trajectory.
So I'll just leave you with this one final thought. As you go about your day, think about the patients on your schedule. Based on the really simple criteria we just covered, who in your practice needs a 5-4 score today?